to all the people who have joined us for this webinar, and also would like to thank Dr. Suresh for being part of this journey. Today, we are very pleased to inform that service has completed almost 40,000 doses, and there is no adverse reaction observed in this past 1 year. And today, with us, we are having Dr. Suresh Gupta, who is MBBS MD, practicing in Gitanjali Medical Store. He's having almost 4 decades of experience, and today he's going to share his service experience with us. Uh, Doctor, we can start the session.
Yes. Am I audible?
Yes, sir. You're perfectly fine.
Yes.
You are.
Yes, dear friends.
Yes,
Dear
sir.
friends, I am Dr. Suresh Gupta. I am a practitioner in Karol Bagh. Today the topic of our discussion is novel 3-dose G protein vaccine, ultimate key for compliance. This is regarding rabies. All of us are aware that rabies is a huge problem in the whole world. And most of the time, if rabies occurs, patient does not survive at all. Almost 100% mortality is there. Few facts about rabies I want to tell that rabies is a disease which is 100% fatal, and rabies is a disease which can be 100% prevented. By the vaccines are so powerful and so effective that if timely given, the vaccine can protect the person 100%. A person can be protected 100% from this disease. It is caused by canines, as you know, mostly dogs in India and bats in USA. And you can see globally, there are 59,000 human deaths annually, highest in India. In India, approximately 20,000 human deaths in a year with rabies is seen. This accounts for 60% of rabies deaths in Asia and 35% globally. So you can imagine how much we are vulnerable to rabies. Indians are vulnerable to rabies, and 91% of deaths in India occurred in rural areas. Current management for rabies is effective, but there are some problems. The first aid is local wound treatment. The wound has to be cleaned with soap and water for 15 minutes, which is generally not done. Some people wash it for 2 minutes, 3 minutes, and for 15 minutes is very rarely washed. That is one deficiency. Then there is active immunization. For active immunization, vaccines are there, very potent vaccines, but the vaccines have to be given 5 times over a period of approximately 1 month. The days 0, 3, 7, 14, 28. The third thing is that can be done is passive immunization, which has to be done there and then only. And it is the ready-made antibodies, immunoglobulins, they are injected at the local site, and if required on the intramuscular on the body also. These are very effective regimens, but the problem is non-compliance. 5 injections of rabies are very difficult to take, and in the many studies it has been found that more than 50% of patients, they do not take full schedule of anti-rabies vaccine. Sometimes even immunoglobulins are not given. Even first aid, the washing of the wound is also not very particularly done as required. It may be done, but it is done less than what is actually required. We had inactivated vaccines, more than 50 years old technology. They were their potency was doubtful, stability was doubtful, availability was not there. There was adverse events. Compliance is a very huge problem in this. We call a person compliant when he has taken all the doses and all the scheduled timings. Then we call it compliant. If the person is taking these doses not at regular intervals or at scheduled timings, then we call it delayed compliant. He has taken all the doses, but not at the right times. Dropout or non-compliant is a person who has taken at least one dose, but after that he has stopped the doses at all. Rabies post-exposure prophylaxis in routine practice. In a patient, 110 patients in a travel clinic, Switzerland, 110 patients were studied, and the shortcoming in the management was noted. In travelers, the initiation of therapy is delayed, generally delayed, because when the dog bite is there and the person is traveling, he may not be able to get the dose at the right time. Human immunoglobulins are generally not given. Most of the time they don't get. And these patients, they develop antibodies which are not adequate. This was found in a significant number of patients. Conclusions: patients do not always receive optimal rabies post-exposure prophylaxis under real-life conditions. A significant proportion of patients did not develop adequate antibody levels after 4 doses of vaccine. This is a study of 4 patients in which all the patients, they expired, although they had taken 3 doses of purified chick embryo cell vaccine. They were not given immunoglobulins. These 3 doses were definitely given. Immunoglobulins were not given. They had so many symptoms, like prodromal symptoms were also there, and CSF findings. All the diagnosis was ultimately rabies encephalitis. But all of the patients died. The reason may be not giving immunoglobulins or giving only 3 doses. The compliance was not proper. This is again another article in which in the Safdarjung Hospital in New Delhi, 360 patients of animal bites were, there was just questionnaire, then they were asked to fill up the questionnaire. It was a pre-designed, pre-tested questionnaire. And it was found that 53% patients were non-compliant to the full course of anti-rabies vaccine. So this is a chart which shows that out of the 5, how many doses are taken by the patients. It is the study from Municipal Corporation Hospital, Bangalore. It is found that first dose is taken by almost 100% patients. Then the second dose on day 3 is 88%, then 85%, and the last dose was missed by more than 40% patients. Only 60% took the doses. So compliance is a really huge problem in cases of rabies vaccination. Why a person does not take anti-rabies vaccine as required? Some people, they forget the dates, approximately 80%. Some patients don't like the cost, which is the number of patients are approximately 13%. Some have distance from the hospital where they don't want to cover. Some are worried about the school timings, and much more number of patients, they were worried about the wages loss of wages. That was 47%. These were the reasons for non-compliance. Evolution of rabies vaccine. For the last more than 200 years, rabies vaccine is more than 150 years, the rabies vaccine is there. And it started with 31 injections to start with in 1885. Since then, there is always efforts are there to make them more potent, more safe, as well as less number of doses, so that the compliance increases. From 31 doses, we have reached to 5 injection in 1976. This is a standardized immunogenicity lyophilized inactivated vaccine cell culture. This came in 1976, but it was ultimately 4 injections. Patients are not compliant to even these 5 injections. Yes. So finding for new vaccines, non-compliance was a major factor, which also was a reason that we needed newer vaccines, which required lesser number of doses. Meeting the unmet medical need, introducing a novel vaccine with simple and shorter regimen. Now we are talking today about this vaccine. This is a novel vaccine, 3G rabies G protein vaccine. It is a recombinant vaccine, and it requires only 3 doses. Rabies virus has got so many proteins in the virus. If we remove the proteins, if we remove the genome, the proteins will remain, and these proteins will have immunogenicity. Means they will cause immune response, but they will not cause disease because genome is not there. Because without genome, they cannot multiply in the body. If the virus doesn't multiply, it cannot cause a disease. So it is a first protein subunit vaccine prepared by virus-like particle platform technology. It is first vaccine in which there are 3 doses which are given intramuscular on day 0, 3, and 7. It has better compliance as a person's total course finishes within a week. There is convenience to use because this is a reconstituted vaccine. You don't have to constitute and give the vaccine. VLP technology. This is a VLP technology, virus-like particle. G protein is difficult to stabilize, but it is by using VLP technology, it is purified, stabilized. It was done by Cadila Pharmaceuticals. This is the virus with genome and protein surrounding. In the first step, second step, after these particles, the nanoparticles, then ultimately we are able to make virus-like particle without genome. Means it has lost the capacity to replicate in the body. These are clinical phase 2 trials in which 2 vaccines were compared with different doses. One, this novel vaccine, G protein vaccine, 3 dose. It was given in 2 doses, 10 microgram in 037 and 037, 03 and 037. And it was compared with the Rabipur vaccine, that is the cell culture vaccine, with 5 doses. And phase 2 data on novel vaccine, it was found that ultimately efficacy was almost similar. Even after 90 days, the immunogenicity was there, complete. And after 180 days, there was slight fall. In 270 days, the fall was slightly more. Safety and immunogenicity of novel 3-dose vaccine recombinant nanoparticles, rabies G protein vaccine administered as simulated post-exposure immunization. It is a randomized comparator controlled multi-cell phase 3 clinical study in which we have tried to find out the efficacy of rabies 3-dose vaccine with reference to the cell culture vaccine, that is Rabipur. Total number of patients were 800 and randomization was 2:1 with this and the Rabipur vaccine. Efficacy, as you see from this chart, this efficacy was almost comparable with both the groups. This is G protein vaccine group, and this is the cell culture vaccine group. Efficacy was almost similar on first endpoint, that is 14 days and 42 days. The efficacy was similar. Safety, when the safety is concerned, some adverse effects were seen with this. The adverse effects were local as well as systemic. All these adverse effects, localized pain, redness, swelling, that was much less with this vaccine, the G protein vaccine, 3-dose vaccine, but they were slightly higher in cases of the standard vaccine we are using, 5-dose vaccine, cell culture vaccines. Similarly, systemic adverse effects like fever, ear pain, headache, urticaria, joint pain, nausea, these were also much less with this vaccine if we compare with the standard vaccine WHO approved. From this study conclusion, we can safely say that novel 3-dose was non-inferior to the reference vaccine, WHO approved vaccine. It has got adverse effects which are definitely less than the vaccine. The novel 3-dose was found to be safe, immunogenic, and was comparable to 5 doses of WHO pre-qualified vaccine. For this study, it has been this molecule has been awarded. The pharma has been awarded by the Economic Times and innovative for the Malaysia. Thank you.
So some Three doses. Hello.
Hello,
Sir,
Arun?
my voice is clear? Hello.
Yes.
Hello.
Any questions?
Yes, Arun, you can continue.
Sir, doctor how is better for compared to 5 doses?
Some issue with connectivity is there.
Yes, that's why, sir, few questions are there. And one very common question which has been asked from many people, people, that is, what are the initial symptoms of rabies?
About rabies.
Yes, symptoms.
Yes, symptoms. Yes, the rabies, to start with, rabies may not have any symptoms. A person comes with bite. The bite may be a simple lick. It may be skin discontinuity. It may be frank wound and bleeding. We call them category 1, category 2, and category 3 wounds. In category 1 wound, nothing has to be done, only clean the surface and forget it. In category 2, where there is abrasion, there is discontinuity in the skin has been damaged to some extent, but there is no bleeding as such, there is no wound as such. Then you have to give anti-rabies vaccine. This is category 2 bites. In category 3 bites, you have to give immunoglobulins also, because it requires infiltration. Immunoglobulins are given at the local site. A person he has got a wound with 20 international units of per kg body weight of immunoglobulins are injected around the wound. If required, if the wound is very large, the dose cannot be increased, but the same amount can be diluted in saline and can be injected in the whole area. If the wound is very small and some of this is left, immunoglobulins are left in the syringe, it can be given on the intramuscular, on the other side of the where this active immunization has been given, ARV has been given. If we are given a ARV on the left arm, then we can give it on the right arm, or in the right arm is the preferable. Deltoid muscle is the preferred for anti-rabies vaccine, because anti-rabies vaccine is always given in the deltoid. Sometimes in very young children, it can be given anterior lateral aspect of the thigh, because gluteal region is not used for this injection, because there the fat is there and muscular tissue is doubtful whether it will go really intramuscular or not. To start with, apart from the wound, there are no symptoms. Then there may be prodrome. Prodrome is a condition in which at the local site, even if the wound has healed, there may be some tingling, numbness, or some twitching type of feeling may be there in that area. This is called prodrome. That is seen generally after a week, and it correlates with the travel of the virus from the local site to the spinal cord. See, in rabies vaccine, it is very important to stop the virus from entering the central nervous system. Central nervous system is brain and the spinal cord. At the local site, anywhere on the hand, on the wound, or on the trunk, wherever it bite is there, it has to enter through a nerve. It enters through a nerve. It travels through the axons of the nerve, and it reaches to the central nervous system, that is the spinal cord. Or if it is the bite is on the face, then it will reach the brain stem. After reaching the central nervous system, it will not be possible to save the patient, because then it is a florid rabid case. Before reaching the central nervous system, all these measures which we are doing, like at the local wound, we are washing it, then we are giving ARV, then we are giving immunoglobulins. Immunoglobulins at the local place, they will decrease the number of viruses. Even washing will decrease the number of viruses. If it is done efficiently and perfectly, then number of viruses, the viral load at the local site will be decreased significantly. Then this vaccine, immunoglobulins, they will also kill the virus. The anti-rabies vaccine this antibodies will start forming in 5-7 days. If these also help before the virus reaches the central nervous system, we can save the patient. When the virus reaches the spinal cord or the brain stem, means the central nervous system, some symptoms of prodrome may be seen at the local site around that limb. These are seen after 7 to 10 days. They may remain for a week. These are bad features to start with. And once the rabies develops, then the features of encephalitis are there. A person is having abnormal behavior. He may be having fits, paralytic fits. He may be having convulsions may be there. And all encephalitis features will be there. So prodrome and encephalitis features are there. In 20% of patients, the patients are paralytic. They are silent. They are not able to move. They have quadriplegia, or the 4 limbs are paralyzed. But ultimately death is there. Generally, we say hydrophobia. A person has got fear of drinking water. That is there. Hydrophobia. This hydrophobia is not exactly the fear of water. It is if a person thinks of drinking water, his muscles of the glottis in the all throat muscles, they contract violently, and he has got very severe pain in these, and he cries. And from the looks, it seems that he is paranoid from this water. He's frightful to see the glass of water, but exactly it is not that. Hydrophobia is the term used for rabies, but that is a general term, but actually it is not fear of the water. It is the contraction of the muscles of the throat, which are very violent and very painful. And they start whenever a person sees glass of water or anything, any liquid, they go into contractions. The patients can remain asymptomatic for 90 days, even 3 months, 4 months, and sometimes 4 months have also been seen. For 90 days, patient may remain asymptomatic. The virus will be there in his body, but it will not be able to reach the central nervous system. In the meantime, if we are able to kill the virus, proper vaccination is done, patient will be saved. But sometimes the things go very fast, and any delay in the vaccination, passive immunoglobulin vaccination, washing, or ARV will be hazardous. And compliance is extremely important, because without compliance, they cannot you cannot save the patient. Once this virus reaches the central nervous system, we have hardly any record where we say that the person has been saved from rabies, 100% guaranteed.
Very well explained, sir. Sir, as we have been explaining regarding this, I want to, this is my question only. Like, if we have been talking about compliance of 5 doses, and what happens, like, if somebody has not completed their full course of vaccine, then it is possible that the symptoms can come after a year or 6 months. Is it possible?
Yes, symptoms may be delayed. When the vaccination is delayed, symptoms may be delayed.
Okay, so that means like doctor,
because
like
the control will be partial. Control of the virus will be partial, and it may take little more time to increase the viral load or to reach the central nervous system. It may be delayed.
Okay, sir. Thank you so much, sir, for this valuable information. It was very well explained by you. Also, you have shared your personal experience, like how the recurrence can come, and how the vaccine, taking vaccine is one of the initial steps which people should follow. Because what we have observed as as a company, that right now people are not that much aware about rabies, the symptoms, how it occurs, and what are the initial things which are to be done. So as a cattle farmer, we are aiming to eradicate rabies by 2030. And doctors like you Thank you for being a part of this journey. And this webinar we have been conducting from past 2 months, and almost 100 doctors they have participated. And we are generating this awareness regarding vaccination. From 5 to 3, we have come down, and we want to gain that confidence that our vaccine is there in just 1 week, we can complete the entire course. So thank you, sir, for being part of this journey, sir.
I'm using Thrabis in my clinic for quite some time now. Whenever you started it, I started giving it, and my experience is very good.
Thank you so much, sir, for sharing that. Thank you so
Thank
much,
you,
sir.
sir. Thank you, sir.
Arun, would you like to have any note and ending note for the doctor or participants? अरुण, आपकी आवाज नहीं आ रही है.
Hello.
I think उनका नेटवर्क का इशू है. Okay, so sir, with this we will end the session. And from
Yes.
Kerala, as a family, we would like to thank all the doctors who have been patiently listening the session, and they have asked the questions which have been very clearly answered by you. So thank you so much, sir. Thank you, Dr.
Thank
Suresh,
you.
for being
Thank
part
you.
of
Thank
this.
you. It's my pleasure.
Thank you,
Thank
all
you.
the participants also. Thank you.
Thank
You can log up. Thank you so much.